Welcome back to the Deep Dive. Today we're tackling a topic that, well, it hits home for a lot of pet owners, the dreaded ear infection.
Definitely common.
Yeah, and you, our listener, you sent us a great stack of sources, articles, research, even your own notes, really diving deep into ear issues in dogs and cats.
And it's good we're doing this because it's easy to just think.
Oh, my pet has itchy ears. Right.
Exactly. But these sources, they really show there's a much more complex world hiding behind that itch.
Totally. What looks simple, like you said, is often pointing to these more technical conditions, right? Like otitis externa and otitis media.
That's right. Those are the clinical terms for where the inflammation is happening.
Okay, so our mission here in this deep dive is to take your sources and really unpack them. We want to go beyond just the obvious signs.
Understand what these things are.
Precisely. Otitis externa, otitis media, what are they? What truly causes them? Peel back those layers.
How they're diagnosed.
How they're diagnosed, what treatments work, what the sort of long-term picture looks like. We're pulling out the key insights because, well, the sources make it super clear.
Yeah, understanding the underlying complexity, it's foundational. You have to know why it's happening to actually fix it.
Otherwise, you're just treating symptoms like the itch or the gunk.
And you're fighting a losing battle. It'll just keep coming back if you haven't addressed the root cause.
Okay, let's dive in then. Structure first. The sources make a pretty clear distinction between otitis externa and otitis media. Maybe start with the external bit. What's otitis externa?
Okay, so otitis externa, that just means inflammation of the external ear canal.
The outer part.
Right. Think of everything from the floppy bit you see, the pinna, down that L-shaped tube, the vertical and horizontal canals, right up to the very outside surface of the eardrum.
Got it. And otitis media then, what's the middle ear involved?
That's inflammation happening behind the eardrum. So inside that space, it includes the bulla, that's like a bony, air-filled bubble in the skull, right under the ear canal. And it involves those tiny little hearing bones, the ossicles, and also the auditory tube, sometimes called the eustachian tube.
The one that connects to the throat.
Exactly, connects the middle ear to the back of the throat.
Okay, so external is the canal to the eardrum, media is the space beyond it. But the sources make a really crucial point here, don't they? That these terms, externa, media, they aren't really the final diagnosis.
No, exactly. They're just descriptions. They tell you where the inflammation is, like the zip code of the problem.
Right, but not why it started.
Precisely. And the sources get into the pathophysiology, how it develops.
Yeah.
With chronic inflammation in that external canal, especially if it's been going on a while, you get big changes.
Like what?
Well, the glands lining the canal, they normally make a bit of wax, but they can enlarge and just start churning out tons of gunk. And the skin and the tissue itself thickens up. In really bad long-term cases, the cartilage can even harden, calcify, turn almost bone-like.
Wow, which must really narrow that canal, right? Making everything
It
worse.
absolutely traps everything in there. And yeah, otitis media often does start from that chronic external problem.
Just creeps inwards.
It can, yeah. The inflammation can spread across the eardrum, sometimes even without a visible hole. Though the sources do point out, especially in dogs with chronic externa, a surprisingly high number do have a ruptured eardrum.
So the infection just spills right in.
Easily. But otitis media can sometimes start on its own, too, maybe from polyps or growths deeper inside, or just fluid building up in that bulla for other reasons.
Okay. And it's not just the ear canal structure itself. The sources mention effects on the skin and exocrine systems and the nervous system.
Right. The external ear canal is basically just folded skin, so skin issues often show up there. That's the skin-exocrine link.
Makes sense.
And the nervous system bit comes in because if that inflammation spreads deeper into the middle or even the inner ear, it's right next door to important nerves, like the facial nerve controlling the face muscles and the vestibular nerves controlling balance.
Okay. That explains some of the weirder signs you sometimes see. So it's definitely complex. Who tends to get these problems most? The sources talk about predisposing factors.
Yeah. Things that don't cause it directly, but kind of set the stage, change the ear's environment.
Roll out the welcome mat.
Pretty much. Both dogs and cats get them, but for dogs, breed conformation is a big one.
Because of their ear shapes.
Exactly. Dogs with those big, heavy, floppy ears, think spaniels, retrievers. Those ears trap moisture and heat, restrict airflow. Perfect setup.
What about hairy ears?
Yep. Breeds with lots of hair actually growing inside the canal, like poodles or some terriers, that can cause problems too. traps debris.
And narrow canals.
Stenotic canals. Breeds like Shar-Peis or Bulldogs are just born with narrower canals, making drainage harder, higher risk.
Oh, and the source mentioned a specific one. Primary secretory otitis media in Cavalier King Charles Spaniels.
Ah, yes, PSOM. That's unique to calves. Their middle ear, the bulla, just abnormally fills up with this thick, sticky mucus. It causes signs often without even having an external infection first.
Huh. Weird. What about environment?
Humidity plays a role. Moist climates mean more moisture can get trapped in the ear. Bacteria and yeast love that.
Okay, so breed, climate, what else predisposes them?
Anything that disrupts the normal healthy balance in there. Too much moisture is a big one, swimming a lot, maybe even cleaning too aggressively or too often.
Washing away the good stuff.
Kinda, yeah. Washing away natural protective barriers. Also, reactions to ear meds or irritation, actual trauma from rough cleaning attempts.
Okay.
Underlying systemic diseases, too. Anything affecting overall skin health or the immune system can make ears more vulnerable.
Right.
And then obstructions. Things physically blocking the canal.
Yeah.
Could be tumors, polyps, maybe really swollen glands, or just a solid plug of hair and wax. And these can be the initial predisposing thing, or they can develop later because of chronic inflammation. It's tricky.
Got it. So those factors make the ear vulnerable. Now, what about the primary causes, the actual sparks that light the fire?
Right, the initiators. Parasites are a huge one for Otitis Externa.
Ear mites.
Ear mites. Otitis cynotus, that's the classic. Tiny little things living in the canal. Super irritating. Other skin mites, like Demodex or Sarcoptes, can sometimes move in, but ear mites are the main parasitic culprits.
Okay. What else starts it?
Hyposensitivities.
Yep.
Big category. Allergies.
Like food allergies.
Could be food, could be environmental stuff like pollens or dust mites, that's isotopy, or even contact reactions to something touching the ear.
So if a dog's itchy elsewhere, their ears might flare up too, because it's all skin.
Very, very common connection. Remember, the ear canal lining is just specialized skin.
Right.
Foreign bodies are another classic primary cause. Plant-ons, grass seeds. Exactly. They can work their way down in there and cause a real nasty, often one-sided infection.
And that brings up a point the source has made, right? If it's just one ear or keeps coming back on one side.
You should be highly suspicious. Think obstruction. Think foreign body, think maybe a growth or polyp in there. Those tend to be unilateral problems.
That makes a lot of sense.
Yeah.
Anything else on the primary cause list?
Yeah, certain skin conditions that mess up normal skin shedding keratinization disorders. They produce too much flaky stuff.
Okay.
Or pets that just naturally produce way too much earwax, cerumen. All that extra material can basically act like a plug, a functional obstruction.
Locks things up.
Yep. Endocrine diseases, think thyroid problems, Cushing's disease, they could be primary causes too. And certain autoimmune conditions where the body attacks its own skin.
Right.
And don't forget that PSOM, Cavaliers we mentioned, that's a primary cause starting directly in the middle ear.
Okay, so we've got the vulnerable setup, the triggers, but then there are things that just keep it going even if you treat the trigger. Perpetuating causes.
This is where it gets really frustrating, the vicious cycle part. Once you have that chronic inflammation, those tissue changes we talked about, the thickening, the scarring, that calcification, those become perpetuating factors themselves.
The ear kind of remodels itself to stay sick.
That's a great way to put it. Exactly. That physical narrowing, the stenosis, it traps moisture, traps debris.
Creating the perfect stone.
Perfect breeding ground for secondary invaders. Bacteria and yeast, they might be hanging around in low numbers normally, but in that environment, they take over.
Which ones are common?
Sources list Staphylococcus pseudointermedius, that's a common bacterial one, often treatable, but they really highlight Pseudomonas aeruginosa.
Why that one?
It's a rod-shaped bacterium, often found in otitis media, and it can be really tough, resistant to a lot of antibiotics.
Oh boy. Others too.
Yeah, things like Enterococcus, Proteus, E. coli can show up as well.
And yeast. You mentioned yeast.
Melissetia pachydermatis, that's the main yeast culprit, just loves that warm, moist, inflamed canal. Occasionally others like Candida.
So these bugs don't start it, but they jump on the bandwagon and make everything worse.
Absolutely. They prevent healing, cause a lot of the discharge and pain the owner sees.
Okay, so with all this going on, what does it actually look like to the pet owner? What are the signs they'll notice?
Well, the history, the things people notice first. Pain is usually big.
How does that show?
Pet might shy away when you touch their head, yelp, maybe stop wanting to chew hard food or open their mouth wide because it pulls on the ear area.
Okay.
Head shaking is classic. scratching at the ears, rubbing their head on furniture, and often a bad smell, malodor coming from the ears.
Ugh, yeah, that smell can be pretty distinctive. Are there signs that hint it's gone deeper into the middle or inner ear?
Definitely. If that inflammation hits those nerves we talked about,
The balance and facial nerves.
right, you might see neurological signs. A head tilt to one side is common. Stumbling, walking in circles, maybe rapid, jerky eye movements. Those suggest peripheral vestibular disease, a balance problem.
And the face.
You might see a droopy lip on one side, inability to blink the eye fully, maybe a sagging eyelid. That points towards facial nerve paralysis.
Okay. And what does the vet actually see when they look in the ear with their scope?
For otitis externa, they'll see redness, swelling of that canal lining. Often it looks narrowed, stenotic.
Right.
There might be scaling or that visible discharge, the exudate. It can be yellow, brown, black, depends on the infection. That causes the smell.
And blocks things up.
Yeah, it can cause temporary deafness just from the blockage. The ear flap, the pinna, and the canal itself will look inflamed, probably painful to touch, itchy. In really chronic cases, the vet might actually feel the base of the ear and the cartilage feels thick, hard, cord-like. That's the scarring and calcification.
Wow. And if it's just one side?
The pet might hold that ear lower or keep their head tilted towards that side.
Okay. Now, otitis media. What are the clues for that during the exam?
Well, remember, it's often linked to chronic externa, especially in dogs where the eardrum ruptures frequently in those cases. So if the eardrum is still intact, the vet might see changes to the drum. The floppy part, the pars flaccida, might be bulging outwards.
Pressure behind it.
Exactly.
Right.
Or you might see fluid or gas bubbles behind the main part, the pars tensa. Or the whole drum just looks opaque, cloudy, discolored instead of sort of clearish.
And if it is ruptured?
Then you won't see an intact drum. You'll likely see pus or debris coming from the middle ear space, maybe filling up the deeper part of the canal.
Yikes. Other signs?
Likely deafness on that side. Significant pain when the vet gently presses on the bulla area under the jaw, or sometimes when the pet opens its mouth wide. In really bad or long-standing middle ear infections, you might even see secondary signs like swelling in the throat, enlarged tonsils, maybe discharge trying to drain down that auditory tube into the mouth, enlarged lymph nodes under the jaw too.
Wow. Okay. That paints a clear picture of how bad it can get. So how do vets pinpoint exactly what's going on? Diagnosis time?
It's a process. Often starts with ruling out other issues. Systemic tests like blood work, CBC, chemistry panel, and a urinalysis can check for underlying problems, like those endocrine diseases we mentioned.
Good baseline. What about allergies?
Yeah, if allergies are high on the suspicion list, further testing might be needed, like a strict food elimination trial for several weeks.
The hypoallergenic diet thing?
Exactly. Or intradermal skin testing, allergy shots, things like that.
And imaging. You mentioned the sources talk about x-rays, CT, MRI.
Imaging is super helpful, especially if you suspect middle ear disease or for really severe chronic cases that aren't responding.
What do they show?
Standard x-rays of the skull can sometimes show if the bully look cloudy or maybe the bone looks thickened, but honestly, CT or MRI give way more detail.
Better view.
Much better. They let the vet see if there's fluid or tissue or growths inside the bulla, check out the auditory tube, see the surrounding structures. CT is great for bone detail. MRI is better for soft tissues.
Okay. What about the hands-on stuff the vet does right there in the exam room?
Key part, direct visualization, looking down the canal with an otoscope. Ideally, a video otoscope is used.
Gives a magnified view on a screen.
Yep. Much better look at the canal, the eardrum if it's intact, and maybe even a peek into the bulla if the drum is ruptured.
What else? Scrapings? Cultures?
Skin scrapings from the ear flap, or maybe a biopsy might be done if they suspect weird parasites or autoimmune issues, or maybe a growth on the outer bits. A culture of the ear goop, the discharge, is really important.
When do they do that?
Especially vital for infections that keep coming back, or if they see rod-shaped bacteria on the initial check.
That's Pseudomonas.
Exactly. The culture tells you which bacteria are there, and crucially, which antibiotics will actually kill them. That's the sensitivity part.
Okay, those all sound important. But the sources really seem to hammer home one diagnostic tool as maybe the most important, especially for the external infections.
Yes. This is a huge takeaway. The single most vital diagnostic tool after doing a thorough physical exam is microscopic evaluation of the ear exudate, looking at the discharge under a microscope.
Not just looking at the discharge, but in it.
Precisely. The sources are adamant. You absolutely cannot tell what kind of infection it is just by its color or consistency. You have to look under the scope.
Why is it so critical? What do you actually see?
Under the microscope, you see the details. Are there ear mites wriggling around? How many bacteria are there? What shape are they, round coti or rods?
Ah, okay.
Is yeast present? How much? Are there white blood cells indicating active infection and inflammation?
So you get a real snapshot of the battlefield.
Exactly. And you need to check both ears, even if only one seems bad, because the infection type can differ.
Good point.
And crucially, for chronic cases, you have to repeat that microscopic check during treatment. The bugs can change as you treat.
Wow, so the appearance of the gunk is totally misleading. Fascinating. The source also mentioned myringotomy.
Yeah, that's a specific procedure. If the eardrum looks intact, but the vet really suspects otitis media is hiding behind it.
Based on imaging or science?
Right. A myringotomy is where they carefully pass a tiny sterile needle through the eardrum to get a sample of fluid directly from the middle ear space, the bulla.
Whoa.
That sample then gets sent off for cytology, looking at the cells and culture, to find out exactly what's brewing deep inside.
All right, diagnosis covered. Definitely more involved than just a quick look and swab. Okay, let's shift to the path to recovery. Treatment. What did the sources stress as absolutely crucial for owners right at the start?
Client education, massive. Showing the owner how to properly, gently clean the ear canal.
If cleaning is needed.
Right, if indicated. And how to actually get the topical medications in there effectively. It's paramount. If the meds aren't reaching the target or cleaning is making it worse, treatment's going to fail.
Makes sense. And sometimes meds aren't enough. Surgery comes into play.
Yes, surgery has its place. It's usually reserved for specific situations.
Like what?
Like if the ear canal is just so severely narrowed and scarred from chronic changes that meds can't penetrate, irreversible stenosis. Or if there's a tumor or a polyp physically blocking things, either in the canal or the middle ear. Or for really severe otitis media that just won't respond to medical treatment.
What kind of surgeries are we talking?
Can range from procedures to open up and drain the bulla, that's a bulla osteotomy, to completely removing the entire external ear canal. That's a TECA, total ear canal ablation, often done along with the bulla osteotomy.
Well, TECA sounds major.
It is. It's definitely an end-stage procedure for ears that are beyond medical help due to those severe permanent changes. But for most cases, medical management is the first approach.
Okay, so what does that medical management involve? Cleaning is key, you said.
Critical first step. Got to get the debris out so the medicine can work. But big caveat, the source is stress. Check the eardrum status first.
Why?
Because if that eardrum is ruptured, a lot of common ear cleaners can be irritating or worse, potential toxic to the delicate middle and inner ear structures.
So what is safe if the drum is ruptured?
Sterile saline is generally safe. Or a very dilute acetic acid solution, basically like a weak vinegar rinse. Those are usually okay.
What about wax dissolvers?
Ceruminolytics. Avoid those if the drum is ruptured. You don't want that stuff getting into the bulla.
Gotcha. Other helpful cleaning agents?
Yeah, antiseptics like chlorhexidine or acetic acid can help reduce microbial load. And TruCDT is useful. It helps break down bacterial defenses and can make antibiotics work better.
Okay. And sometimes a deep clean is needed.
For ears just packed solid with gunk, yeah. Often requires sedation or anesthesia for a really thorough flush to get it all out.
All right, ear is clean. Carefully, if the drum's iffy. Then comes the medication. Systemic pills, injections, and topical drops in the ear.
Exactly. Systemic meds are usually needed for definite otitis media and also for really severe or chronic otitis externa.
How long?
Sources suggest a minimum of 4 to 6 weeks for these cases, often longer for otitis media, especially if bone might be involved, like 6 to 8 weeks or more.
And the type of med?
Yeah.
Antibiotics?
Antibiotics, yes. Ideally chosen based on that culture and sensitivity test results, especially for those stubborn infections or if you see rods.
Right.
Common choices might be things like cephalosporins or amoxicillin clavulinate for typical cocci infections. For rods, maybe fluoroquinolones or potentially systemic aminoglycosides, used carefully.
What about antifungals, systemic ones?
Yeah, usually used along with topical antifungals if there's a significant yeast or fungal component. Meds like ketoconazole, fluconazole, itraconazole might be used.
And inflammation. Got to tackle that too. Really.
Crucial. Anti-inflammatories help reduce the swelling, the pain, and also slow down that excessive glandular secretion. Often, corticosteroids like prednisone or dexamethasone usually started at a higher dose and then tapered down.
Okay. And if mites were the trigger?
Then systemic antiparasitics might be part of the plan too, things like ivermectin or selamectin.
Got it. Now topicals, the stuff you actually put in the ear.
Sources say topical therapy is paramount for resolving otitis externa and for long-term control. Key.
But clean first.
Clean first. Can't stress that enough. Get the debris out so the meds can actually touch the infected lining, and use enough volume you need to fill that canal.
What kind of topicals are common?
Lots of combination products out there, or single agents. Topical antibiotics like gentamicin, neomycin, enrofloxacin.
Antifungals?
Yep. Often imidazoles like clotrimazole or miconazole, or maybe nystatin or terbinafine for yeast.
Anti-inflammatories too.
Yes, usually potent topical corticosteroids like dexamethasone or betamethasone, really important for knocking down that inflammation and itch quickly. And sometimes topical antiparasitics if mites are the issue.
Okay, it really sounds like treatment has to be tailored based on everything found during diagnosis. Are there specific warnings or precautions?
Definitely. Big one. If the eardrum is ruptured, be really careful with most topical cleaners except that saline or dilute acetic acid, and certain topical antibiotics, especially the aminoglycosides like gentamicin, neomycin.
Potential ear toxicity. Ototoxicity?
Potential, yes. Risk of damaging the inner ear, causing deafness or balance issues. The sources do note it's a bit controversial how high the actual risk is with topical aminoglycosides and a ruptured drum in practice, but caution is warranted.
Okay. What else?
Ivermectin, if used systemically, needs caution in certain breeds, particularly herding broods, due to potential genetic sensitivity, the MDR1 gene issue.
Right.
Also, be super gentle when cleaning any ear with severe or chronic otitis. That eardrum can be really fragile from the inflammation and easy to rupture accidentally.
Good point. Anything else pop up?
Post-flushing vestibular problems like sudden dizziness or balance issues right after a deep clean are noted to be more common in cats than dogs. It's usually temporary, but owners should be warned it can happen. And of course, any topical med can potentially cause irritation or an allergic reaction. If the ear seems worse after starting treatment, definitely need to reassess. Oh, and the sources mention using corticosteroids when otitis media or interna is suspected is a bit controversial, balancing the anti-inflammatory benefit against potential effects on deeper healing or immune response.
Lots to consider. Okay, so we've diagnosed, we've treated. What about looking ahead? Follow-up, prognosis.
Monitoring is key. Doing repeat microscopic checks of the exudate is really useful. See if the bugs are dying off, if the cell types are changing, if maybe a different bug is emerging.
Makes sense. And long-term, prevention.
Routine ear cleaning by the owner if the vet recommends it for that specific pet. But the absolute biggest thing for prevention is identifying and managing the underlying primary cause.
Controlling the allergies, treating the thyroid condition.
Exactly. If you don't manage the trigger, the ears will likely keep flaring up.
What are the potential long-term complications people should know about?
Unfortunately, sometimes there are lasting effects. Permanent deafness is possible if the inner ear gets badly damaged. Some level of residual vestibular disease, maybe a permanent slight head tilt or subtle balance issue, can remain even after the infection clears.
Facial nerve paralysis, too.
Can sometimes be permanent if the nerve damage is severe. The infection could potentially spread from the middle ear to the inner ear, otitis interna, or very rarely even to the brain, causing meningoencephalitis.
Scary, though rare.
Very rare. And remember those post-flushing vestibular signs in cats? Consider that a potential, usually temporary complication.
Okay. And the expected course. How quickly do things usually get better?
Sources suggest otitis externa, if you get the diagnosis right and treat appropriately, often resolves in about 3-4 weeks. But big if.
If the primary cause is fixed.
If the primary cause is identified and corrected, and crucially, if those irreversible perpetuating factors haven't set in.
The stenosis, the calcification.
Right. If those are present, the ear canal is permanently changed. Those factors won't resolve, and they will cause recurrence because the environment just isn't normal anymore.
Okay. What about otitis media?
Takes longer, often needs those systemic antibiotics for 6 weeks or even more until all the signs are gone and hopefully the eardrum has healed. If there's bone infection suspected in the bulla, think 6 to 8 weeks or longer for antibiotics.
And the vestibular signs, the dizziness, head tilt.
They usually improve within about 2 to 6 weeks, but the sources are clear. There are often residual symptoms. That slight tilt, a bit of wobble, might never fully go away.
So wrapping this all up, we started with what seems like a simple itchy ear, right?
Yeah.
And we've uncovered this really intricate picture. External versus middle ear inflammation. These layers of causes predisposing, primary, perpetuating.
Yeah, it's not simple at all.
And seeing how vital diagnostics are, especially looking under that microscope. And treatment isn't just one size fits all, but this careful mix of cleaning, topicals, systemics.
Tailored to the specific infection, the specific patient, the underlying cause.
And the prognosis really hinges on catching the trigger and whether those permanent changes have happened.
It really drives home that ear disease isn't just about the infection you see today. It's this whole dynamic process, anatomy, underlying health, environment. They all play a part.
Understanding those cause categories, predisposing, primary, perpetuating, seems absolutely fundamental for managing it long term.
It is. That microscope check tells you who the bad guys are right now, but you still got to figure out why they got invited to the party in the first place.
And for you, our listener, going through these sources, it really gives such a clearer picture of why these ear problems can be so darn persistent, doesn't it? And why just throwing the same drops at it over and over often fails.
Yeah.
You need that thorough workup.
Yeah.
It shifts the focus from just, putting out the fire.
To understanding what keeps lighting the match.
Exactly. Well said.
It changes the question from why won't this go away to what underlying factor is driving this and what permanent changes might be stopping it from healing.
Right. So here's a final thought to leave you with. Thinking about those perpetuating factors, those irreversible changes, how they often mean chronic ear problems shift from a cure mentality to more of a long-term control or management focus. What does really understanding that whole complex cascade mean for your perspective on approaching chronic health issues in your pets generally?
It definitely underscores the value of getting on top of things early, doesn't it?
Yeah.
Investigating thoroughly to try and prevent those permanent changes from ever happening.
Absolutely. A lot to think about there. Well, that wraps up this deep dive into the complexities of pet ear infections. Thanks for joining us.
Always great to dig into these topics.
We'll be back with another deep dive soon.